I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Friends, on an attempt to awareness on men's health, important to touch a topic which is obviously missed out. And this important topic is about Peyronie's disease. Peyronie's disease, a disease which actually a lot of men go through. The incidence is talked about anything between 8 to 15% of mature male population could be going through an aspect which is called a bend or a curvature in the penis. That means an organ which is normally straight and pointing with a mild tilt to one and all can undergo a bend or a curve to either down or to up, something which makes life very difficult. In other words, a mature male in his late 30s, 40s to 50s and 60s can undergo a change in his organ where the penis undergoes a bend, and this is called as the Peyronie's disease. Peyronie's disease is a disease where there is a plaque or there is a bulb or there is a ghat kind of a thing which is gradually developing in the penis. As the penis undergoes a change where there is a small amount of fibrous tissue which is holding it back and developing slowly as a button that you feel sometimes, it brings about a change in the curvature. So what happens to men? How do men present to me as an andrologist? Is about men talking that they have got a discomfort in the penis. More discomfort, more pain during performance, more pain during erections. So none of the men in the world should have pain during erection. They should get a sensation, they should get a good feeling and capability to perform. But if men start feeling pain in their penis, painful discomfort in the penis, which is something which they are worried about, they're scared about, and the better the erection, more the pain, is probably in a subset of patients an early change in Peyronie's disease. Not everybody, but many. In other words, you have got a discomfort, you've got a pain, and when an andrologist examines you by examining the penis well, he actually finds there's a palpable plaque or a hardness somewhere there. The hardness could be long, could be short, could be small. Changes happening which actually give you discomfort, and that discomfort again is not static. So in the early days in Peyronie's disease, you can get a discomfort, pain, bend, and all this is very uncomfortable. You cannot perform, you cannot get an erection, erections are getting difficult. As this acute phase starts resolving with medical management and with changes in progression, you could have a bend which develops. And that bend is something which is so bothersome. So somebody was great in the bed, somebody is now trying to adjust himself in the bed because the angulation of the penis in erect penis is something which makes him incapable. It may be possible with progression, he is not able to capably insert and do a sexual intercourse because the angle is quite difficult, quite significant. So Peyronie's disease, a disease about pain in the penis, about a palpable plaque or a nodule, about a penile curvature, is a disease of agony, a disease of mature men which they go through. It's a disease which progresses to a point in time where the natural history is about from an acute difficult phase which is picked up by many patients. Many men don't pick it up at all. They don't have much discomfort. They're managing themselves. It probably goes to maturity, where suddenly you find a very hard thing in the penis. A doctor would do a sonography and look at a plaque. Plaque may sometimes not be visible and palpable, but there can be a bend. And this bend can be such that you're not able to perform. So what are the kind of subset of people we see? One set of people who come very early with discomfort, pain in the penis. And if that is so, is it an early part of change in your penis which could lead to Peyronie's disease? Number one. So such patients we see quite early. They are very capable, they are very aware, and they come to you. The second part of people who come in is the pain comes only during erection, not all the time. And the erection probably is not so good. So there is an erectile dysfunction developing in Peyronie's disease as a progression of change happening. So we take care of the discomfort and pain as a neuralgia, as a pain in the organ when there's a stretch happening, where there's a plaque developing. Then come those patients who actually progress to a very chronic state, and that's quite a large subset of people. Could be very young, could be late 30s, and could be 50s and 60s too. That's when mature phase of life. So 4th to 5th decade is where this can start. And this is unfortunately more common, I see now, in diabetic individuals. So diabetics may suffer more frequently compared to non-diabetics. But that there's no causal relation. It's only an incidental report that we talk about. So many men could have this along with various other changes in the region of the palm, in the region of the plantar fascia, where facial contractions are happening around. So some areas of the other parts of the body also are tight. But the large aspect of Peyronie's disease is about looking at that there is a change happening in the penis. There's a deformity, there's a penile shrinkage, There's a curvature, there's a pain, and there's an erectile dysfunction when you can't perform. So some men could have great erections and a very tight bend. Some men may have a plaque palpable, but no erections. So these could be two very difficult scenarios which could happen. And that's where one needs to treat and correct. When we treat a disease, we go to the bottom of the disease and treat a disease. In Peyronie's disease, we are not treating the disease per se. We're treating the effects of the disease. In other words, you're going to see the effect of erectile dysfunction, effect of curvature or bend, looking at the discomfort and pain, looking at erectile loss, looking at a penile shrinkage. So all these aspects, which could be a uniplanar curve or a multiplanar curve, the penis will be bent kind of situation because of not one but multiple plaques. So Peyronie's disease, unfortunately, is a phenomena which is missed out. Not much epidemiological studies exist in India because not many people would come out and talk. Only when this awareness reaches all men in this country, men get to know that my neighbor, my brother, my friend perhaps has got an issue in erectile dysfunction. So ED is a common term that is used for all kinds of erectile problems. But this common erectile problem where the bend in the penis is making him incapable, and which is called as Peyronie's disease, is to be treated for the effects which Peyronie's disease gives to a man. So this is completely treatable. We need to look into aspects that he deserves to be treated for. Does he have erectile dysfunction? Does he have pain? Does he have bend? Does he have a plaque which is too hard? What is that aspect which is bothering him and bothering his capability? Many men say, I have no bother, I'm comfortable. And many men are very bothered with the early phase or acute phase of pain, discomfort. When that matures over the months to years, they can get into mature disease. So there are treatments available. Treatments are partly medical, partly surgical, partly various prosthetic devices, which helps you to stabilize yourself. So I don't think in today's world, with the kind of awareness that we're putting forward to you, reaching men's health problems to men in the mature age group, men should get demoralized. Unfortunately, it brings about too much of morale loss, a lot of capability, and a lot of issues that they go through the mind. We need to correct them and get them sorted out. Obviously, it's a hand-holding journey. We need to hand-hold the journey of these men and these couples, help them out, counsel them, treat them, give them the best under the circumstances, and they get back to normalcy. So Peyronie's disease problems have to be treated, have to be brought back to a cure where their curvature first, their pain, the discomfort, the erectile loss, and incapability has to be treated around. Friends, a lot of thoughts have been given to Peyronie's disease in the past, but because not much practice is happening on Peyronie's disease, a lot of men continue to suffer. They continue to get various treatments which may not be completely fruitful. So it's important to take your awareness, see your doctors in your cities, and don't miss out on this very important therapy for a disease which is so agonizing. It is so much of agony, so much of discomfort, so much of disgust that not getting treated, my body is progressing where there is no mistake done. So not everybody is a smoker, not everybody is a diabetic, but this change in Peyronie's disease or angulation or curvature in the penis is not an uncommon phenomenon. We need to wake up to this, and if it is there, the andrologist is helping you out. Thank you so much.